Hello, my name is Cara Maciag, and I'm going to be presenting about the TED Talk, How Augmented Reality Could Change the Future of Surgery, presented by Dr. Nadine Haram. To start, some background information about the speaker. Dr. Haram is a Lebanese surgeon, lecturer, and clinical entrepreneur who has traveled around the globe sharing her ideas and opinions about the topic of augmented reality surgery. She was born in California and then graduated from the University College in London with her medical degree in plastic surgery and restoration. In 2018, she received the British Empire Medal and the Queen's Birthday Honours for her innovative work within the fields of surgery and medicine. She now works in London for the National Health Service when she came across the issue of distance being a key factor in many individuals not receiving the specific medical care they need. The main issue she found was the limited number of trained professionals in certain countries and absence of access to vital surgical services. With the help of her staff, she found that in some countries, there are as little as 10 surgeons present to provide medical care to almost 6 million people. This comes out to equal one surgeon for every 600,000 people residing in that one country. They also found that around 5 billion people worldwide lack the necessary surgical care that they need. This is a rising expectation about having access to and the quality of healthcare provisions, and with the increased demand, there needs to be a better, faster solution. Dr. Haram and her team decided that needed to change, and came up with the company Proximie Medical. This company that she created allows doctors from around the world to communicate through augmented reality and gives skilled surgeons the ability to walk another surgeon from anywhere in the world through a complex medical procedure. Their main objective is to prepare, perform, and perfect surgeries around the globe utilizing this program. Using everyday items such as laptops, tablets, and phones, they are able to be connected during the entire procedure. The trained surgeon is able to see the surgery happening in real time and pinpoint every incision and maneuver that needs to occur during the procedure, while the doctor performs the task being shown to them. They are able to mark up patients and visually scrub in and watch the procedure in real time. This allows anyone in the world to have access to some of the most elite doctors in other countries, all through augmented reality and without having to be physically present. The surgeons are then able to prepare and learn the procedures after being shown how to do them, to the point where some have perfected the skills and done procedures solo without the need of assistance anymore. This technology, she says, is saving doctors time, money, and other vital resources. It can reduce costs by not having surgeons spending their money and taking time to fly to other countries to perform the surgeries. This will also be greatly used in teaching hospitals so that mentors are able to be there during the mentees' surgeries and walk them through it, but allowing them to do all of the physical work and be there by themselves, giving them the confidence they will need for future. According to the Proximie website, there are 6 different ways that augmented reality is transforming the future of healthcare. Number 1 is clearly to improve access. As stated before, more and more countries will now have the ability to complete surgeries that they were not once able to do, since they now have a skilled teacher walking them through it. The second is boosting training. Since there is a shortage of medical professionals and surgeons, this new technology allows for a highly engaging and immersive educational experience that allows for complex concepts to be grasped much easier without the need of one-on-one training, which takes up time and resources. Another benefit is that the new technology is speeding up the adoption of other technological advancements. For those using this technology already, it will give them a background that they can then expand on and use to further the development of their techniques and programs. Especially with the current crisis of a major global pandemic, which is affecting the medical community in a huge way, finding different avenues to communicate and share ideas with one another is at an all-time high. Other than just being able to work together on surgeries, surgeons can use other features that assist with their practice. With the technology, it allows them to perform tasks such as seeing 3D visuals of the internal organs on their patients, and even using the AccuVein tool to help locate veins for cannulation. Empowering patients and delivering other treatments such as physical rehabilitation are just two of the other ways the program can be used to help their clients. It allows patients to be able to play an active role in their treatment and rehab after, by being able to see in 3D what they are going through, and especially during rehab, making sure they are doing exercises and activities the correct way by following along with demonstrations from home. Now, I have come up with some possible questions about this new technology and how it may work in certain areas. The first being how comfortable some patients may be with becoming a test subject to this kind of procedure, and how safe they would feel without the trained surgeon there in the room performing their surgery. In any medical operation that uses technology such as this, there would no doubt be a waiver that the patient would need to fill out giving consent to the procedure occurring. But there are other circumstances that may occur, such as complications during the procedure and the fact that technology always has the ability to malfunction, taking away the person giving the guidelines to the procedure. Another obstacle I found with this technology is that there is already a lack of medical professionals, as Dr. Hachacharam stated in her talk. So wouldn't these procedures, which utilize two surgeons working together from different locations, further exacerbate this problem? This single operation is taking up the time of two surgeons who could be doing two separate surgeries. Yes, the single surgeries may not be as complex as the one they would be doing together, but it would allow for more patients to be seen. The last question about this new technology that I had was how it could be utilized in areas that do not have access to the type of technology needed, such as computers, tablets, smartphones, and even simple internet connections. The areas of the world that may benefit most from this type of sharing could not have these resources. So what happens then? Would Proximity Medical be able to provide these resources needed to these other countries, or would they be left out? These are the references I used for this presentation, and thank you for listening.